Hi, my name is Alyssa Johnson, and I'm going to do my first video on a client named Jennifer. She's 38 years old, Caucasian female, and she is the mother of two teenage boys, which I think is important to bring into this because one of her children is diagnosed with bipolar disease, which is also a major stressor in her life, which is one of the reasons she's seeking therapy. Is to deal with her diagnosis of generalized anxiety disorder with panic attacks. That's her official diagnosis. She is prescribed clonazepam, 0.5 milligrams, 2 to 3 times daily by mouth. That is prescribed by her psychiatrist that she sees once every 1 to 2 months, depending on how she's doing. Let's see. Clonazepam is also known as Klonopin, which is like the brand name for this drug, and the clonazepam is like the medication name, like the generic name, I guess is what they say. It's used for patients with anxiety, seizures, and panic disorder. So it's also considered an anticonvulsant as well. So clonazepam works by it affects the chemicals in the brain that may become unbalanced and cause anxiety. It's also under the umbrella of benzodiazepines, which is any class of heterocyclic inorganic compounds used as tranquilizers. So that's the class the clonazepam is. And it's a Scheduled 4 controlled substance. The side effects include drowsiness, tiredness, loss of sleep, loss of coordination, increased saliva production, which is kind of all expected and something that's used as a tranquilizer because it's trying to down the mood. Clonazepam, also a small number of people that are prescribed anticonvulsants also experience depression and suicidal thoughts and other mood problems that should be informed to the therapist, so that where the therapist can, help the client work through what is normal for this drug and what is not normal for this drug. What to expect when taking this drug, I think I kind of went over that with the side effects, but it's used so she doesn't have panic attacks on a daily basis like she had been. I think a lot of being a social worker, like that person and environment is really big in this situation because she has so much going on in her life. Like she just lost her job and she's in a bad relationship with her boyfriend. They're on and off again. Having a lot of issues with her children, like I said. My role in supporting the client through her medication trial is making sure that it's working as it's supposed to. Like she's having reduced panic attacks. And not as far as her feeling as though she is tranquilized, though, like real mopey, can't get out of bed, that kind of stuff, because I feel like those kinds of drugs can do that to people. To make sure maybe the dosage is correct on it. I know most of that stuff usually goes by weight, but you never know with how severe her panic attacks might be or anxiety might be. They might need to adjust it a little bit. Or just how many times daily, because she is taking it 2 to 3 times daily as needed. So, and that is a pill, by the way. It's not it's just a pill by mouth that you take. I think that this drug is important for Jennifer because, I think a lot of people are diagnosed with generalized anxiety disorder and learn coping skills to deal with those. But I think it's the panic attacks that is what sets her aside from people just using coping skills to deal with their generalized anxiety disorder without medication. Since she has panic attacks, I think it's important to help Jennifer not only learn the coping skills, but also give her something that will allow her brain to calm down when it doesn't need to be wound up, so to speak. This is just a trial for her to try this, but she said that she had been on this drug in the past and that it worked out, but she had been on other medications for her general medical history, so she had to quit taking this drug. Um, so, I'm not sure of any other drugs that would really be as beneficial to her. Like I said, clonazepam, which is really the best bet for her. And she is attending therapy weekly, once a week, and she's also getting community support services, which is someone that can take her to and from therapy, her other mental health appointments, because she doesn't have a car, she's low income. So I think the other supports are going to be really important, as much important as the clonazepam is going to be for her, to help her deal with that general anxiety disorder, along with the stress that she kind of has to learn to cope with, like in positive ways. I mean, she has tried working out and like that kind of stuff, but it just doesn't work out. Like, it doesn't last. She gets bored of it. So right now we're working on her coping skills, and as far as them being positive. She stated that she likes to eat when she gets anxiety, or sleep a lot. So we're trying to get away from that and more positive things, such as recognizing her anxiety early on. And she has a tendency to make irrational decisions when she's anxious and gets irritated. So we're really working on thinking about our consequences and the things that you say and how you can't take that back. So that's really what the plan is for Jennifer. She sees her psychiatrist again in 3 weeks, so, and I have a release for him also, so if she needed to change, or if she would like me to talk to him, but really my job is to make sure that everything is going as planned, since she doesn't see the psychiatrist as often as what is really needed. And my job is, she has any questions, I can answer those questions for her. And if I don't know, I mean, I can ask a coworker, I can, do research on my own, but most of the time I have a good knowledge of clonazepam because I have other patients that have used this in the past. So that is my plan for Jennifer.